care of residents with dementia, mental illness, or mental retardations. This module reviews how to care for residents with dementia, mental illness, and mental retardation. The resident in your home come from a variety of backgrounds, have different life experiences, and have unique personalities. Some are easygoing and cheerful, some may like to argue, some are very active, others are relaxed and content. In addition to the basic differences, many may also have impaired mental abilities, whether it has been a condition all of their life or more recent onset. As a direct care worker, it is important to have a good understanding of each resident with whom you will be working, including those who have mental deficits or impairments. In this session, we'll look at three main causes of cognitive impairment. You will be able to identify the symptoms, describe some of the behaviors common to those conditions, and identify methods of interaction that are most effective in dealing with challenging behaviors. Every person is different and everyone has a good days and bad days. It will be important to get to know each resident and develop your skills in working with each resident as an individual. Now we will go over mental retardation. What is mental retardation? A person with mental retardation has lower intellectual functioning, meaning his or her IQ is significantly below average. He or she may need help with daily living skills needed to live, work, and play in a community. These include communication, self-care, social leisure, and work skills. The abilities of people with mental retardation is different. Most people with mental retardation are mildly affected and are able to learn new skills. With appropriate supports, all individuals with mental retardation can live satisfying lives in the community. Mental illness. What is mental illness? A mental illness is a disturbance in behavior, mood, thought process, social skills, or interpersonal relationships. There are many different types of mental illness and different levels of severity. A resident with a mental illness may be younger and in the home due to his or her care needs, or the resident may be elderly with a mental illness. This will be important issues to know about each individual. A resident with mental illness may feel deep sadness, may hear voices, may be very suspicious of others, may change moods quickly, or have emotional highs and lows. These are symptoms of mental illness and not a person's choices or bad behaviors. Many people with mental illness are treated with medication under the care of a doctor. This medication can greatly reduce the symptoms of the illness, but many often have unpleasant side effects. It will be helpful to you and the resident if you take the time to learn what medication is being taken and the side effects. You may also notice that there is frequently a cycle that occurs with some mental illnesses. A person can be doing quite well for a period of time and then start to slip into some of the symptoms of their illness. Dementia. What is dementia? Dementia is a gradual decline in mental and social functioning compared to an individual's previous level of functioning. A resident may have memory loss, personality change, behavior problems, and loss of judgment, learning ability, attention and orientation to time and place, and to oneself. Alzheimer's disease is the most common cause of dementia, and we will spend more time on this as it will likely be one of the more frequent causes of cognitive impairment of residents in your facility. As the disease progresses, the person is unable to judge between safe and unsafe conditions and will need help to dress, eat, bathe, and make decisions. There may be personality changes such as increased suspiciousness, unfamiliar people, places, and activities can cause confusion and stress. The person shows less interest in others and wants to withdraw to familiar, predictable surroundings and routines. The person in later stages has difficulty performing basic activity of daily living. Some common behaviors associated with Alzheimer's disease are rapid mood changes, crying, angry, pacing, wandering, doing things over and over, asking the same question, following people closely, and inappropriate sexual behaviors. Base behavior management skills for working with residents with cognitive impairment. Now that we have a basic understanding of three of the most frequent reasons for cognitive impairment, we will look at some basic behavior management skills. As stated throughout this training, you are likely to be faced with challenging behaviors on regular basis. If you develop strong skills in managing these behaviors and in communicating effectively with residents, this will help you in dealing with difficult situations and provide better care for residents in all aspects of your job. Remember, you are just touching on these basic principles. There is much more to be gained by learning more about positive behavior techniques, and you are encouraged to seek out additional training, observe people who use these trainings and techniques effectively, and take notice of your own interactions and how you can improve upon them. In addition to the basic ideas we will discuss here, residents in your care will have specific support plans developed by the care team. It is important to become familiar with these plans and use your skills to follow them. Tool number one, you want to ask questions to figure out the reason for the behavior. Tool number two, you want to use positive reinforcement techniques. For example, if you see a good behavior by a resident, praise the good behavior. Behavior that is rewarded will be repeated. Tool number three, listen with understanding. Tool number four, smile and keep it positive. Believe it or not, a smile can go a long way when working with people. The times you feel least like smiling are when it will be the most important that you make your best effort. Take a deep breath, go into the room with a smile.